What is that? It's too hot? No, it's okay.
Yeah, she's pretty good at that. She likes people giving her tea.
A last cup of tea for Phyllis before she prepares to leave hospital.
Isn't it, Phyllis?
At home, when she was at home, she wouldn't stop drinking tea. You'd have to make...
Like nearly 40% of patients at the Royal Free, Phyllis has been diagnosed with dementia. The hospital has redecorated day rooms and even the walls and doors of the wards to make them less daunting for patients.
The care in here has been fantastic for my mum. They've got her back better. She was really bad when she came in here. She had 3 infections. She wasn't eating. She was being sick. And after just over a week, or was it 2 weeks? One or the other. Anyway, she's got so much better and she's smiling and laughing again, which she wasn't doing when she came in here.
And you look much better, Phyllis.
Good stuff.
I love the eyes.
Downstairs is this.
Whisper to your person.
Not perhaps what you might expect when it comes to training staff in how to deal with patients with dementia, but something of a first. A theatre group brought in to teach everyone from security guards to nurses new techniques.
You're so busy, you've got so many patients and you've got things on your mind. So someone's talking to you, something that's probably really important to them but not to you, and you're looking at them but you're not taking anything in. I found myself going, oh, that's great, when they've just told me something that's really not great. So yeah, that's taught me to be actually more involved with the patient. Even if it's 3 minutes, give them that 3 minutes fully. Yeah.
Obviously you get your day-to-day, you're very busy, but sometimes you have to, when the situation happens, it will come back to, and you'll remember this session and be like, oh, come to, because sometimes you don't even know that the patient has dementia. You won't know until they start doing certain things.
Can we have 2 people from each group to come and get your patient, please?
The training is about getting back to basics, about remembering to smile, about body language, about facial expressions.
Hello, are you feeling safe?
I think a lot of time people are so time constricted that some of the basics go. So this is trying to strip it back to the very beginning and just say, let's think about it, let's think about how we react in the moment.
Wow!
Taking a medical approach to managing dementia is not that sensible, and yet in a hospital that's what we get very bogged down in, you know, the pills, the antibiotics, and what patients with dementia tell us often is that's not what they're looking for. They're frightened, they're scared, they want the human touch, and sometimes we're programmed not to do that.
Back upstairs, Phyllis is getting ready to leave the Royal Free, a hospital, like all others across the capital, learning to deal with growing numbers of patients with dementia.
I don't know. Yeah, so you're going this afternoon. And we just hope that